Hello, Muhammad family. My name is Dr. Isabella Bain, and this is Dr. Lauren Polito, and we are here to inform you the next steps towards healthiness for your child, Tina.
As you know, your child has been diagnosed with PKU, which is a quite rare disorder and unfortunately is potentially dangerous to baby Tina. Essentially, what is occurring, mom and dad, is baby Tina's digestive system is unable to work efficiently because people with PKU are not able to break down the protein they digest from foods into amino acids, specifically phenylalanine. This creates buildup in the bloodstream and brain and could sadly result in brain damage.
You may be wondering how baby Tina even inherited this disorder, which may be shocking to you. However, it was unfortunately passed on from you, Mr. and Mrs. Muhammad, by a genetic mutation. I want you to understand none of this is your fault, since parents who are carriers of PKU don't have any symptoms. The type of mutation passed on is classified as a single gene autosomal recessive inheritance, meaning each of the two copies of mutated gene does come from both of you, one from mom and one from dad. Since both of you were carriers of the gene, the probability of baby Tina actually inheriting PKU was a 1 in 4 chance. Being solely a carrier of the gene was a 1 in 2 chance, and also a 1 in 4 chance of receiving a pair of normal genes. The following diagram depicted is the Muhammad family pedigree. As shown, Mr. and Mrs. Muhammad are both carriers of the gene, and as said before, 1 in 4 of their children will come out with PKU, which in this case was baby Tina. 1/2, aka in this case 2/4 of their children will turn out as carriers, while lastly 1 in 4 of their children will come out without PKU or being a carrier.
I understand that this may be quite a lot to digest. However, we are here to help you and your child every step of the way. The good thing to acknowledge is since there wasn't an indication of PKU before, we have caught the disorder fairly early, which means baby Tina will be able to live a happy and healthy life with the right treatment given and a change in her diet. If we don't start the treatment as soon as possible, I'm afraid baby Tina could have damage in her brain and nervous system, which can lead to learning disabilities for her in the future.
We want baby Tina to have the healthiest quality of life for the future, so we will be referring you to a dietitian which will provide you with a diet regimen for effectively treating PKU. Baby Tina would need a low-protein diet avoiding high-protein foods like meat, eggs, and dairy products, and control her intake of many other foods such as potatoes and cereals and aspartame. Either mom or dad may administer an amino acid supplement, ensuring baby Tina is getting all the nutrients required for normal growth and good health. For a safer option, you can opt for PKU specifically designed foods, which are available through a prescription such as flour, rice, and pasta. As baby Tina gets older, her dietitian will alter her diet along the way.
In order to properly assess baby Tina's PKU, we do need to regularly give blood tests to measure the level of phenylalanine in her blood, and we will also be able to see how she is responding to her treatment. If either of you, Mr. and Mrs. Muhammad, would like to be trained in order to administer a proper blood test to your child, it is very possible. Throughout the course of time, when baby Tina is under 6 months old, their blood should be tested once a week. Between the time of 6 months and 4 years of age, they should have their blood tested once a week or every 2 weeks. And at the time of 4 years of age or older, they should have their blood tested at least once a month.